Drug Utilization Review, DAW codes, and returns. The Drug Utilization Review. The Drug Utilization Review is now known as the DUE, or the Drug Utilization Evaluation. It is an important process in ensuring that the correct drug is prescribed for a condition. Pharmacists must perform this function, but pharmacy technicians play an important role in the DUE process. When technicians are inputting prescriptions, the DUE alerts interrupt the process for a drug interaction or duplicate therapy is found. Technicians must never override this warning on the computer without the pharmacist's consent. They must notify the pharmacist immediately, so he or she can screen the medication order for potential problems, such as drug-to-drug interactions, duplicate therapy, or other possible errors. This is done before the drug is dispensed, and what this does, it reduces the risk of a patient receiving the wrong medication. A formulary is a list that describes all the medications covered under specific insurance plans approved for an institution use, such as a hospital. It may also offer alternative medications if the first choice is not covered. For medications to become part of a formulary, they must meet certain requirements, such as effectiveness and cost. And these are determined by pharmacists, pharmacy technicians, physicians, nurses, and administrators who are members of the P&T committee, or the Pharmacy and Therapeutic Committee. Formularies are not the same at all institutions or for health plans. An institution can have an open or a closed formulary. Open formulary means the drug can be ordered and stocked for patient use. A closed formulary places certain restrictions on drugs ordered. Many formulary drugs are the generic versions of the proprietary or the brand name product. These drugs are effective as the brand name, and they meet the same bioequivalence requirements, but are less expensive. A health plan or prescription plan committee composed as the pharmacists or the people before the P&T committee compose the list for each place of business. The FDA ensure that they are cost effective. Special consideration may be given to drug companies that bid or give rebates when their drug is chosen for the formulary. This decrease in price to the pharmacy ultimately saves money for both the insurance company and the patient. DAW codes, or dispense as written codes. The dollar amount of a prescription also depends on orders, such as dispense as written drugs that require specialty codes. The three codes that are the most often used in the pharmacy setting are DAW0, DAW1, and DAW2. DAW0 indicates that the physician authorizes a therapeutic alternative and the pharmacist can dispense the generic drug to the patient. If a generic drug is not available, the trade name product must be given. However, the DW code must still be 0 because this indicates that if a generic becomes available at a later date, the physician has given permission to the pharmacy to make substitution. The pharmacist can find the therapeutic equivalent in the Orange Book. You'll learn about the Orange Book at a later date. The DAW1 indicates DAW and is usually used by the physician to indicate that the trade or brand name medication is in some way medically necessary for the successful treatment of the patient. Often patients must have proof that the other therapies have been tried but failed. Sometimes, such as in this case, the drug Celebrex, a patient must be age 50 or older. Physicians must write either brand name medically necessary or dispense as written in their own handwriting. And then we have DAW2. This indicates that the physician has approved the generic substitution of the medication prescribed. However, the patient is insisting on receiving the brand name. There are other infrequently used codes such as 3, 4, 5, 6, and 7, I think 8 and 9, and you'll learn about those in your next chapter. Technicians must be aware of and understand the proper use of DAW codes for accurate insurance billing. Insurance companies audit pharmacies. They specifically verify whether DAW1 claims sent to the pharmacy have prescriptions in which the physician specifically indicates the brand name drug to be dispensed. The selection of proper DAW codes is easily overlooked and can cause seemingly simple mistakes. However, if these mistakes are found in an audit, they can cause the reversal of repayment to the insurance company, and it may result the insurance company terminating the contract with the pharmacy. Formularies are constantly changing. If and when new generic drugs are introduced, cost and other factors are reviewed. Typically, the types of drugs not included on a formulary are new drugs, uncommon drugs, extremely expensive drugs. However, if a non-formulary drug can be justified as medically necessary substitution by a physician, it may be approved for reimbursement under the insurance plan. Returns. Medication is returned to the warehouse or manufacturer for four main reasons. You have drug recalls, damaged stock, expired stock, and medication that's about to be expired. So let's talk about the drug recalls first. Drug recalls come in three different classes. You have Class 1, Class 2, and Class 3. Class 1 recalls are for drugs that may pose a serious threat to users' health or even death. And Class 2 recalls for drugs that may cause a temporary health problem and have a low risk of creating a serious problem. And then Class 3 recalls are for drugs that violate FDA regulations concerning container defects or have a strange taste or color. Manufacturers are required by law to recall any product that has been found to violate any of the following guidelines. Labeling is wrong, product has not been packaged or produced properly, drug batch was contaminated, or the FDA has required removal of the drug from the market as a result in safety risk, and any other change occurs that causes the drug to fail outside the FDA or manufacturer guidelines. The recalls notices may arrive at the pharmacy by mail, email, or fax. The notice should identify the necessary information about the drug or device in question. The information includes the drug name and the reason it is being recalled. One of the most important pieces of the information provided is the lot number of the drug. The lot numbers are assigned by the drug manufacturer to identify a specific batch of medication. This is the key to identifying the recalled medication. The lot number is found on the bottle along with the expiration date and the NDC number on the bottle. If a pharmacy finds recalled medication on its shelf, a report is normally generated identifying the patients who have received the medication within the past 30 days, and the patient is notified. The prescriber should be notified if the patient has received any of the recalled medication. The pharmacist should place the recalled medication in a designated area or container for return to the manufacturer or disposal in accordance with the recall notice. Technicians are responsible for checking all of the drug stock throughout the pharmacy facility to ensure the recalled drug is not in stock. If it is found in stock, then you have to return the medication to the manufacturer per the recall instructions that are written on the recall when it is sent in. If it is not, you are initial that you do not have this medication in stock, and you will send that piece of paper back to the manufacturer. You can find most recent recalls on the FDA webpage under recalls. Damaged stock. If you notice some drugs are damaged en route to the pharmacy, but you were not aware of the damage at the time or delivery, it is not too late to return the damaged stock to the manufacturer. It may be necessary to first contact the manufacturer and obtain the authorization before the damaged goods are returned. A customer may also um, notice damaged stock. Sometimes EpiPens or Imitrex injections have bent needles or broken plungers or other issues. In these cases, the patient returns the medication and the pharmacy replaces them. The pharmacy must then contact the manufacturer, who sends a replacement to the pharmacy directly and may or may not collect the damaged merchandise. Expired stock. Some pharmacies have policies to pull any medication expires in 3 months or sooner. This ensures that no drugs on the shelves are close to their expiration date. Depending on the contract between the pharmacy and the manufacturer, it may be acceptable to return items as long as they've been bundled into a minimum package size rather than as partials. For instance, if a stock of acetaminophen expires within 3 months, the manufacturer may allow it to be returned for full or partial credit if the box of 100 can be returned at one time. Following manufacturer's guidelines for returns is important. Hazardous chemicals, including cytotoxic agents, must be repackaged carefully to avoid breakage during transportation. Medication that is about to expire. The pharmacy personnel can also pull and return slow moving stock that has 9 to 12 months before expiration. The pharmacy can receive credit from the wholesaler, who in turn may be able to resell the drug to another pharmacy. This applies only to unopened bottles, and regulations varies according to the wholesaler and manufacturer specific for policies. Many pharmacies have a service that process returns to drug companies for a percentage of credit obtained. These companies visit the pharmacy at various times, ranging from 1 to 3 months or at once a year, and complete all the paperwork and documentation for return expired inventory. As mentioned before, you have automatic return companies. Some companies' sole job is to process returns for hospital, wholesalers, pharmacy chain stores, and independent retailers. They are responsible for all records and recalled items and for the disposal of hazardous waste. Pharmacies contract with these companies for regular pickups. It is the pharmacy's responsibility to choose a licensed, qualified business to perform these services. For examples of auto return companies, some examples are Return Solutions, Guarantee Returns, and PharmaLink. Many items cannot be returned to the manufacturer. Some examples of non-returnable drugs or any drugs are any drugs that is reconstituted or compounded in the pharmacy, partially used bottles of medication, and any drugs that have been repackaged by the pharmacy. These drugs, including most reconstituting agents, can be discarded in the pharmacy garbage. This should not be allowed to infiltrate the water supply. In most cases, especially in chain pharmacy, the drugs are sent to a central location for destruction or returned to the manufacturer for credit. Many agents must be disposed of carefully, such as cytotoxic agents. These are the ones that deal with mostly the chemotherapy drugs and some just hazardous waste. There is a certain way for these things to be disposed of. Controlled substances must be counted and co-signed by a pharmacist before they are destroyed. Before any scheduled medications are destroyed, the DEA must be contacted for specific instructions concerning the destruction. A pharmacist must always be present to co-sign for the disposal of controlled substances and must return required information about the disposal to the DEA. The DEA issues a receipt for the Schedule II merchandise destroyed. This receipt must be kept in the pharmacy for 2 years from the date of the receipt or disposal of the Schedule II inventory. Returns for medications that are not picked up. In addition to regular inventory returns, technicians must routinely check patients' medications ready for pickup that have been left, that may not be picked up because of the unknown changes in medication, hospitalization, or costs. Those that were charged to insurance must be reversed to the third party by electronic submission to the credit the patient to remove the prescription from their insurance. Once the completed prescriptions are removed, names and other permanent information are blacked out and labels are placed in a HIPAA trash container. Medications that have never been left the pharmacy may be returned to stock bottles. If it has left no medication can never be returned by a patient if it has left the pharmacy area.